This poster presents the results of our prospective population-based study that investigated risk factors for the onset and persistence of chronic fatigue and chronic pain syndromes, namely chronic widespread pain, irritable bowel syndrome, and chronic orofacial pain. These pain syndromes have recently been classified as chronic primary pains by ICD-11. The baseline findings of this study, which are shown here, showed that for the first time these chronic pain syndromes co-occur in the general population, with 1% of a randomly selected general population reporting all four of chronic widespread pain, chronic orofacial pain, irritable bowel syndrome, and chronic fatigue. This cross-sectional investigation also showed here that these chronic pain syndromes had common associated psychosocial factors, and these included reporting of high levels of health anxiety, somatic symptoms, adverse life events, sleep disturbance, depression, and anxiety. Current NICE guidelines propose a biopsychosocial approach for management of chronic primary pain and recommend a targeted approach depending on predictors for these syndromes. The purpose, therefore, of our current analysis was to determine those who were vulnerable and resilient to developing these syndromes, and also investigate predictors of vulnerability so that these can be targeted by future interventions. The study had a high response rate, and here you can see that we had an adjusted participation rate of 84% after accounting for those who had been lost to follow-up due to ineligibility to participate, or those who had deceased, migrated, or refused to take part. The study design was a prospective population-based study. Vulnerable subjects were defined as those who had two or more syndromes at baseline and continue to have two or more syndromes at 2-year follow-up. Resilient subjects, on the other hand, were defined as those who were free of syndromes at baseline and those who were free of syndromes at 2-year follow-up. Predictors of vulnerability and resilience were psychosocial factors here from baseline, which were entered into a logistic regression model, which was adjusted for age and gender. The key findings are shown here in this table, and we can see that psychosocial factors predicted vulnerability to developing these chronic pain and chronic fatigue syndromes. However, the strongest predictors were depression and sleep disturbance, and you can see that depression had an 8-fold increased risk. So those who reported high levels of depression at baseline had an 8-fold increased risk of developing these syndromes at follow-up and were vulnerable. Sleep disturbance had a 3-fold increased risk of having these syndromes at follow-up. Similarly, when we looked at resilience, we found that those not reporting high levels of depression and sleep disturbance were resilient to developing these syndromes at 2-year follow-up. Therefore, the conclusions of this work suggest that future interventions need to target both depression and sleep disturbance as key factors in prevention and management of these syndromes. This research was partly funded by the Wellcome Trust and Arthritis Research Campaign. If you have further contact or questions, feel free to email me, and thank you for your attention.